My name is Dr. Amgad Makarios. I am the chairman of cardiology at New Health, Nassau University Medical Center, which is part of the regionalized cardiac care services of the North Shore LIJ health system. I'd like to share with you today a paper that we worked on and are publishing titled Multi-Detector Coronary CT Imaging for the Identification of Coronary Artery Stenosis in a Real-World Population. Just to give you a little bit of background about why we performed this paper, we all know that multi-detector coronary CT imaging has become an integral part of our diagnostic armamentarium in cardiology for the evaluation and diagnosis of coronary artery disease. What a lot of the landmark papers and studies have done when they've looked at coronary CT imaging compared to our current gold standard of diagnostic invasive coronary angiography, is they've highly selected a lot of their patients. And what I mean by that is a lot of these landmark initial papers excluded patients, for example, with high amounts of calcium in their arteries, patients with irregular heartbeats, for example, AFib, or atrial premature or ventricular premature contractions, and other excluded or patients who might actually preclude or make it more difficult to interpret the results of the cardiac coronary CT. Now, we all know that when you do that, that's an ideal thing to do when we're performing a study like that. However, in our current real-world population, we sometimes encounter patients that might be more difficult in terms of performing this study. So what we wanted to do is actually look at our patients, which our hospital is a tertiary care center performing a large number of coronary CT angiograms in a real-world type population. So what we did is we looked at a total of 1,818 consecutive patients who were referred for multi-detector coronary CT angiography, secondary to multiple indications for the CT. And the CT angiography was performed using a GE Lightspeed VCT, and we evaluated these patients and compared the results that we obtained on the coronary CT with the current felt to be gold standard of invasive coronary angiography. A total of 164 coronary arteries and 410 coronary segments were evaluated, and the overall per vessel sensitivity, specificity, positive predictive value, negative predictive value, and accuracy were assessed, again compared to the gold standard of invasive diagnostic angiography. And what we found is that compared to prior studies, our results for the sensitivity, specificity, and the other variables that we looked at were not as good as the landmark or a lot of the major initial studies comparing CT with invasive coronary angiography. Our numbers were actually somewhat less, but that we actually found to most likely be related to the fact that we basically looked at all of our data, and because of that, these prior reports had higher values because they had selected their patients, but our patients were more of what we called a real-world type of population. So our report tends to be more realistic of an unselected patient population, but at the same time, our sensitivity, specificity, positive and negative predictive values were still highly diagnostic of coronary artery disease and therefore useful in a clinical sense, but were therefore actually more indicative of what standard clinical practice in a real-world population would show. Thank you.